It can take months or even years for stroke patients to recover, and only a small fraction regain normal use of their hands and arms.
But a breakthrough here in Chicago could change that. In this original report, CBS 2's Susanna Song shows us how it works.
Go ahead and look straight ahead.
Daryl Holmes suffered a stroke nearly 5 years ago, debilitating the left side of his body.
There were detailed things that I could not do, tying a tie, for example, tying shoelaces, bathing myself.
Your other ear.
For 6 weeks, he worked with researchers and doctors at the Rehab Institute of Chicago.
Nose.
Without being invasive, Dr. Lynn Rogers can stimulate areas of his brain.
When I give him a pulse,
And through a new navigation system, she can find the exact spots to target and see the images in real time.
What it can do is that if we do repeated stimulation, it can change how that brain fires. So over the course of time, it changes how responsive that area is.
The point is to stimulate the healthy side of his brain.
We can lower the excitability of that uninjured side and get rid of all that noise.
Quieting down that healthy side and allowing that injured side to be able to step up, speak up, and do its job.
The stimulation balances the brain, which helps make traditional therapy more effective and longer lasting.
One is that we can get better outcomes, so they can do even more. But we want them to be able to do even more faster.
Holmes credits the combined therapy for this big coup.
Tie my tie, my hygiene. I think I started driving before the study was over.
Researchers say it works when you add 15 minutes of stimulation to the 1 hour of therapy 3 times a week for 6 weeks. Patients were able to maintain the improvement 6 months later, even without consistent therapy. And I should emphasize this has yet to be approved by the FDA. It's just a study.
But it looks like with those kind of results, it's pretty promising.
Yeah, and they're actually expanding it to 12 different clinics across the country, testing out 200 patients.
That's fantastic.
Nice to see you on the day shift.
Yeah.
It is nice to be here.
All right,
Thanks, Susanna.